The other case study that's found in Chapter 3 about getting started in building a strong team it involves a team that is put together to address the nursing shortage in a state. And they are put together as the result of a legislative initiative that studied the nursing shortage and came up with an idea for the development of a nursing workforce center in the state as a state agency that would be created through legislation. Because no action was taken by the legislature, a number of the stakeholders in this particular commission got together and identified the need for a team to begin to work together to think about how they could push this legislation forward. The team works together to identify a common mission and to identify the skills that they need as a team to be successful in meeting their mission. The book actually goes into how you develop a mission as a team and a vision and how you use that in your work. But in this particular case study, I'd like to highlight how the team then began to look at the skills that they would need in order to be successful in meeting their mission. They used a technique called skill gap analysis, where they identified the skills that were required, the level of skill that was needed in the team in order for them to be successful, the density of the skill that's required by the team, so meaning how many people on the team must be strong with that skill, and who on the team actually has that skill. If a gap is identified, the team develops a plan for addressing the gaps through developing those skills in the group, adding team members who have those skills, or perhaps contracting with a consultant. So for instance, the team knows that in this case, they'll need knowledge of existing data and analysis techniques so that they can make their case. And they know that at least one person in the group must be expert in this skill because they're going to have to do the analysis of data and they have to present the data. Only one team member on this particular team had the skill, but the team realized that all team members needed to understand the data and the analysis because they were going to need to communicate as well. And so they identified an opportunity to develop the skill in the team as opposed to adding more team members or adding a consultant. And they came up with a plan for developing a course called Data 101 for all of the team members. In the book, what I've done is provided you with the skills to perform a skills gap analysis and also a helpful tool that teams can use to guide their analysis, to record their analysis, and to develop their plans. So I hope that hearing about some of the case studies in the book have interested you in learning more about team leadership, the intentional development of teams and the intentional development of the people on teams, and certainly much more about teams. Everything from strategizing to communicating to analysis of organizations in which teams work, to measuring team success, to the use of metrics in order to measure that success, and certainly leveraging the results of teams within and outside of an organization. So those are all the things that are found in the book, Team Leadership and Partnering in Nursing and Healthcare. And you can find more about the book at www.springerpub.com. Thank you.